There was unfortunately a terrible rumor circulating that for some reason African Americans don't get coronavirus. That rumor is completely false.
California Surgeon General Nadine Burke Harris is reminding people that the virus doesn't discriminate, but there is a disconnect when it comes to people of color in healthcare.
Because of the true and unfortunate history of medical maltreatment of different groups of people, but especially African Americans in the United States, there are real issues of trust between the African American community and the healthcare system.
African Americans make up 6.5% of the state's population in California, but numbers so far show they account for 7% of the coronavirus cases here and 8% of the deaths. Roseville doctor Tom Hopkins says that's due to the fact that they are at a higher risk to the virus for a variety of reasons.
Hospitals have to now pay attention to social determinants of health as well, to recognize that these folks that are coming in, are at a disadvantage in a lot of cases.
He says many African Americans don't have a primary care doctor, so lack of education about the virus also plays a role.
They've really been left out of the system, if you will, so they never had great access. So when something is happening now, they stay home. They may wait to the last minute before they go in, when they needed to be seen earlier.
Greater Sacramento NAACP President Betty Williams says locally there is much to be done to make sure that those who look like her do survive the pandemic.
If you don't have testing in the real communities like the Del Paso Heights, the Meadowview, the Oak Park, where a lot of our community live, stay, and pray, and yet we don't have a site there where they can go and get tested